Welcome back to SYNLAB Podcast. We are still addressing the crisis of antibiotic abuse. In the previous episode, we talked about implications of antibiotic resistance. Now we are going to be looking at innovative approaches to antibiotic management. I am still Uchenna Amadi, your host, and I'm with the amazing Dr. Afolabi Obe, the Chief Medical Officer of SYNLAB Nigeria. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. So, Dr. Obe, I was quite amazed by the story that you told in the previous episode.
Okay.
So I wanted to know, in that situation where you're between the devil and the deep blue sea, you have somebody in the ICU whom, if you save the kidney goes, if you save the kidney, the man goes. In that situation, what would you do?
Okay. Well, I wasn't expecting you were going to ask that question again because
I took interest.
Regardless of what we do at that point, it's we're already at the dead end, right? So what we should be talking about is going forward.
Yes.
How do we prevent this from happening?
Yes.
Right. And I think that is the dimension I want us to look at it.
Okay.
That's a dead end.
Yes.
Either which way, infection will kill the person.
Oh.
Right? Chronic kidney disease, if not properly managed, and because you're also going to be eating that, one way or the other.
Okay.
We have the healthcare sector and society and everything has pushed that man to that level.
Oh.
But then what can we do? Like for example, in medicine, there is a concept of mortality and morbidity review.
Yes.
Meaning that
I'm
periodically
yes.
you want to say, okay, in the last 1 month and the last 1 week, what are the things that has led to death?
Yes.
How can we prevent this for
Yes.
other people that are coming?
Yes.
So it's that angle I want to handle this.
Okay.
So what can we do? In medicine or in medical microbiology, there is a concept of antibiotic stewardship. I'm going to break it down.
Okay.
But then what it means is that everybody should see it as a problem. And everybody should know that I have a role to play. So, number one level, at individual level, there should be an awareness that I should not abuse antibiotics.
Of course.
Right. That's level one. Level two, as the hospital level, doctors should not be prioritized to prescribe when it is not necessary.
Yes.
Right. Still at the hospital level, doctors should put a closure order on antibiotics. We still see people just write one antibiotics, just leave it open.
Oh.
Patients on the ward just continue to take it till thy kingdom come.
Okay.
There should always be a stop order.
A duration
of time.
Must be clearly stated.
It must be clearly stated.
Yes.
From the beginning of.
Otherwise, you will either overdo it or underdo
exactly.
it. Yes.
Again, at the hospital level, there is a need for our hospital to embrace policies.
Okay.
Right. Have a policy on antibiotics use. These antibiotics would not use it except put a condition where those antibiotics could be used.
Okay.
Now, why are you doing that? You are preserving those antibiotics so that when the need arises, you see where to fall back at.
Sure.
Right.
Yes.
And there is a concept of pre-authorization in medicine, meaning that these antibiotics, so before you use it, this person must give approval.
Wow.
Right.
Yes.
Now, that's the level of the hospital. At the level of the hospital, there should also be an antibiotic policy.
Okay.
Right? These are the things. And again, at the hospital level, there should be a good laboratory support. Meaning that, except it is extremely necessary, you don't start antibiotics until the laboratory says yes.
Okay.
Right.
Yes.
Now, at the national level, we need to have, yes, I'm aware we have national antibiotics policy.
Okay.
But how much of the policy gets down? How much of the policy do people know? So there is a need of continuous education so that we would not make us to get to the point of that man where we'll be at the dilemma of the kidney and infection.
Yes.
So these are the things we need to do at the individual level, at the national level, at the hospital level, at the national level, to combat antibiotics resistance.
Dr. Obe, this is quite interesting because the next question I was going to ask, you've already dealt with it because you've even gone beyond the role that the healthcare professionals should play in promoting this. You've gone to the national level, you've gone to the hospital level and the rest of them. So I want to go to the obstacle part. What do you think are the obstacles that can prevent us from implementing these policies, in helping to implement effective antibiotic management?
We're in this country together. Me and you, we know the obstacles. I mean...
No. You believe in a new Nigeria.
Yes, I do believe in a new Nigeria. And of course, I must tell you, I believe in a new Nigeria.
Okay.
And I look forward to a Nigeria where, I will be able to take, maybe it will be possible with my children again. Maybe my grandchildren, not because they don't have money, they should be able to take their children to public school.
Okay.
Right. I look forward to that Nigeria. I look forward to a Nigeria that I can call, maybe not 911, I can call emergency number, and I'm sure that an ambulance will be in front of my house. I look forward for a Nigeria where, somebody will have a cardiac arrest and we're sure that the person has a 70-80% chance of coming out of it. I look forward to that. So I believe in a new Nigeria.
Okay.
I believe in a new Nigeria where politicians will not just go there because they want to amass wealth for their generation. I mean, I look forward for that. And I believe it could happen in my own lifetime. I mean, I so much believe that. So if you see me contesting tomorrow, I mean, not because I want to be like them, it's because I want to make a difference. And I do believe that I can make a difference. So let's go back to why we're
the obstacles.
Here. Yes, let's go back to
that will affect the implementation of this.
What are the obstacles? Number one obstacle that I see, let me start from the government side. We have policies.
Sure.
Like for me in this country, I mean, policies has never been our problems. Our policies are clearly documented.
Yes.
But unfortunately, no enforcement. So there needs to be a way to make sure that the policies that we have regarding antibiotics are implemented.
Okay.
I think that is very important. Number two, I mean, we have mentioned that there is a need for good laboratory support.
Yes.
Right?
Yes.
I mean, I am coming to you. I don't know why I like to mention urinary tract infection again. You have urinary tract infection and the doctor is saying, first go and do a test. How much is the test? And 15,000, what have you? How much is the antibiotic to treat me? Maybe 6,000 naira. And the man is going to cough out the 18, 20 something thousand naira. The man will tell you, doctor, Shebi, if I use these antibiotics, it will
go.
You will not want to lie now. You say, yes, it will work now. And so the man will tell you, let me not do the test. So as long as we continue to do out-of-pocket payments, right, we're not going. So for me, obstacle is out-of-pocket payments.
Yes, okay.
Even for the people that are covered with insurance, what is the level of the coverage?
Coverage, yes.
Right.
Yes.
You tell me then because someone is a cleaner, then you cannot access the highest level of care.
Yes.
Is it a crime to be a cleaner? Is it not a Nigerian? You get all of us cannot be the head of organizations.
Yes, we can't all be at the same.
Are you telling me that the heads of one, are you telling me that the guy that has the full coverage is more Nigerian than the other person? Has he offended God by being a cleaner?
No.
So there are certain things I don't think we should play sentiment about. Healthcare, education at the national level. So even the people that are covered with insurance, how much of the insurance cover do they have?
You will still see some of them paying out of pocket.
You get it. So for me, at the level of the government, then again at the level of the government, now there is this abuse of antibiotic sales. I mean, we have said it in the previous series that anybody anyhow can sell antibiotics.
Yes.
Right. The government needs to do something about it. In fact, I mean, I had an experience some few years ago that a particular high-ranking antibiotics, were impounded at the airports. And when they went and do, efficacy tests, they discovered that less than 20% of active ingredients that is supposed to be there was actually there. It means that you are supposed to give 200, 500 milligram of the antibiotic, supposedly.
Yes.
So if you take that brand and give, you are actually giving 25% of 500 milligram.
Wow.
And you tell me that there is no resistance. Resistance will happen.
Of course.
So the government should find the way from the point of production to the point of sales. There should be
to the retailers.
Policies. To the retailers, there should be clear-cut policies, and we should make sure that these things are followed. That's on the national landscape.
Okay.
Now, at the hospital landscape, I think hospitals should begin to do surveillance and antibiotics audits.
Okay.
The antibiotics that will work in, which are the big hospitals in Lagos? Luth or Lasut may not be the same antibiotics that will work in, say, Gwagwalada General Hospital.
Okay.
Right. So individual hospitals should have antibiotic surveillance. Do an audit of antibiotics you have used before. Right. Excuse me. Know the ones that are resistant.
Yes.
That you would not use. Know the ones that are sensitive.
Okay.
Excuse me. That you can use. Right. These are the things that hospitals should do at their level. And then hospitals and governments and non-governmental agency should do a lot of education about antibiotics abuse. So the community, like we're doing now.
Yes.
So the society would know that, man, we should not abuse this.
Yes.
I mean,
I agree.
That's how much that is coming to my brain now.
I agree. And this has been quite illuminating. Very, very illuminating. To my listeners, you can agree with me that these innovative approaches, they offer hope. Please, whatever you do, when you hear this podcast, share with your people. And don't forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify. Don't go anywhere. We'll be back shortly.